Breast cancer occurs when you have an abnormal growth in the breast. Once that cancer cell breaks off and spreads and starts growing somewhere else, that is considered late-stage disease, and that stage 4 disease if it's growing in the bone, the liver, the lung. We stage breast cancer based on the size of the tumor and lymph node involvement, and it's based on the number of nodes involved and sometimes also whether or not the disease is breaking through the lymph nodes under the arm. Early stage breast cancer would be considered cancer that's contained within the breast area and or the lymph nodes. Most people consider early stage disease that is less than 5 centimeters and with not a lot of disease in the lymph nodes. So we have many lymph nodes under our arm. Most people consider early stage when you have 4 or less lymph nodes involved with disease. Most patients with early stage breast cancer don't have any symptoms. Most of the time we're finding those cancers on a mammogram or a screening ultrasound. When there are symptoms, a woman might see a rash on the nipple. She could see bloody nipple discharge. Some women might notice a breast mass on self-exam. If that's the case, they should bring that to their doctor's attention because occasionally that can be a breast cancer. Very rarely breast cancer is painful, but honestly, most masses that are painful turn out to be something else. So the earlier you find a cancer, usually we're hoping we can give less treatment. So if a woman comes in with a small cancer, potentially she can avoid chemotherapy. She can avoid a mastectomy. If a woman comes in with a bigger tumor, often we have to give chemo. We sometimes have to do mastectomies. The treatment is just more aggressive across the board. Patients absolutely should be optimistic if they have an early stage of breast cancer. Now we really have great treatments even for aggressive cancers, and we're seeing success with that.